Good afternoon, everybody. You're welcome to Global Women Prayer Network. Thank you for joining us again. So today we are starting our meeting and we have our guests ready to impart knowledge to us, especially to everyone who is believing God to carry their babies, who is believing God for fruitfulness in their marriages. Either you are part of the church or you are not. Everybody, we want to welcome you because we know that this is a session that a lot of people would have paid for, but we are so glad that we have a very amiable, generous doctor that is ready to impart to us the knowledge and the wisdom we need as we go about our activities concerning this major challenge. So today I want to quickly introduce what we stand for, and I want you to know that everything we do here is basically to the help of humanity. There is nobody has any special gain, nobody has any personal gain in this, because God has created us to impact and to be a blessing to everybody. So I would just quickly want to share vision of this prayer network. We are known as Global Women Prayer Network. So our vision is to ensure that every believing woman is liberated to live victoriously and witness God's power in their personal lives, homes, families, and nations. So also our mission is to empower every woman to partake of their inheritance in the redemptive work of Christ through regular monthly prayer meetings and programs that will bring us to seek after God's heart and also work with Him in total trust. And another thing that we also want to achieve as women is to be fulfilled in life. And I know this cuts across different areas of life. It cuts across our marriages, our businesses, our careers, our personal lives, and every other thing that you desire to achieve. So the core values, we have 5 main core values. We are Christ-focused. We walk in unconditional love. We are consistent prayer people. Then we also want to support every woman in contact with us spiritually. And then we are also interested in the total well-being of everyone associated with us. So we are going to start the symposium for today, or whatever you want to call it, the symposium, the meeting, the talk show. And the topic today before us is dealing with infertility. We want to explore the signs, the causes, the treatments, and the facts around infertility. I know a lot of couples who are struggling or find it difficult to cope with this situation. And most times they allow this to lead to a strain in their relationships. And this also affects family members in a way such that at the end of the day, sometimes nobody is there to defend them because everybody just allows them to make their decisions. Sometimes they get separated, they get divorced. Sometimes they just live in bitterness and then they keep blaming themselves for this particular situation. So here we have this afternoon, and we have to present to you our Dr. Taufik Olabode, who is here to impact with knowledge and to open our eyes to see how these problems can be resolved medically. We know that God has given our doctors wisdom, to handle things like this. And peradventure, maybe your situation is just all about medicals. And so this meeting is going to be very important for you to partake and to understand and apply the things that Dr. Taufik will be sharing with us this beautiful afternoon. So I'll quickly introduce our doctor. And before I introduce him, I just want to appreciate him and to celebrate his heart for being available, giving us the time in the midst of his busy schedule to take us on this journey. So right away, I'll just read out the profile of Dr. Taufik Olabode. Dr. Taufik Olabode had his first degree in January 1997, MBBS from the University of Ilorin, Kwara State. He had his postgraduate training in O&G at Obafemi Awolowo Teaching University, AUTHC, Ile-Ife, and completed the training in October 2007. Dr. Olabode is a fellow of West African College of Surgeon, 2007, and also a fellow of National Postgraduate College of Obstetrician and Gynecologist in 2009. He had a certificate course in IVF and reproductive medicine organized by UKSH Holstein in Germany in United Arab Emirates. Now, Dr. Olabode also doubles as the chief consultant gynecologist and obstetrician to Lagos State government hospitals, and as well as the MD of Bolasat Specialist Hospital. So I want to present to you our dear doctor. He is a seasoned doctor with proven results in terms of medical solutions to the issues of infertility. And here we have him to take us in this journey. And I want you to prepare your questions. I want you to be attentive. I want you to get ready to connect to the wisdom that God has given to him to share with us this afternoon. So join me to appreciate him and welcome him to this meeting. God bless you. Dr. Olabode, we are glad to have you, sir.
Okay.
All right.
I've done that.
It's good to have you here, sir. Thank you for coming.
I'm so happy to be in your gathering. This is an interesting gathering. The first thing in life is education. So that when one is well educated about any situations, one will be able to decide and take an appropriate decision on time. This afternoon, I'll be discussing dealing with infertility, science, causes, treatment, and facts. First, I will be talking on introduction. What is infertility? How many types of infertility we have? What are the causes of infertility? What are the signs and symptoms of infertility? And how do we investigate an infertile couple? Infertility is defined as failure to achieve conception after 12 months of unprotected, adequate intercourse. Prevalence of infertility is about 15 to 20%. Most times in gynecological clinic, it accounts for 65% of our gynecological consultations.
Wow.
Chances of conception per cycle is about 25%. What this means is that if, for instance, now, for a young lady of about 20 to 25, if everything is fine, the tubes are okay, she's ovulating, they're having adequate intercourse, the chances that she's going to conceive in a month, in a cycle, is 25%. However, if the same lady is 37 years old, the chances of conception per cycle at that age is just 15%. At the age of 43, the chances of her getting pregnant in that cycle is just about 5%. So this shows that age of a woman has a significant role to play in infertility. In the first 6 months of marriage, for instance, now, if you have about 100 couples and they are having regular adequate intercourse, in 6 months, about 60% of them will have conceived. In a year, about 80 to 85% will have conceived. By the end of second year, about 90 to 95% of the couple will have conceived. It will be only 5 to 10% that have problems with conception. What are the various types of infertility? We have primary in the sense that the couple, there has never been history of conception in that marriage. It is primary. However, if there has been history of conception in that marriage, irrespective of the outcome of the conception, it is secondary. So before we move forward, we have to talk about physiology of conception. How do pregnancy occur? There are 3 conditions that must be met before pregnancy can occur. 1, the sperm must be deposited in the vagina at the point of ovulation. 2, the tubes must be open, and then the woman must be ovulating. The brain of woman, especially the pituitary gland, secretes some hormones called FSH, LH. This in turn act on the ovary, which allow the eggs to grow. From the beginning of cycle, about 10 to 15 eggs are recruited every month. However, about 15 or 20 eggs are recruited every month. By the mid-cycle, around 14 days of menstrual cycle, is only 1 egg that is dominant enough to drop, to ovulate. So when ovulation occurs, the same egg enter the tubes. When it enters the tube, then there is intercourse at the same time. The sperm will move from the vagina through the cervix to the uterus, then to the fallopian tubes. Towards the end of fallopian tubes, the egg and the sperm meet and fertilization occur. When the fertilization occur, then there will be cleavage. Cleavage means division. When the egg and the sperm fix together, they form 1 cell. Within the next 24 hours, this same cell divide. It divides into 2, into 4, into 8, into 16, and 32. As the embryo divides, it also moves towards the uterus. So on day 5, day 5 after fertilization, it will form what is called blastocyst. So this blastocyst will now get implanted in the womb. So when it gets implanted in the womb, then the process of development continues until delivery.
Wow, awesome.
So what are the causes of infertility? It's divided mainly into a male factor. That male factors means the problem is from the man. And we should all note that about 50% of infertility is caused by male factor. The remaining 50% is by female factor. Female factor, under female factor, we have ovarian factor, but that is the ovary. Maybe the woman is not ovulating. Then we have the tubal factor, that is the tubes. If the tubes is blocked, it will be difficult for the sperm to pass and meet the egg along the line. Then there is uterine factor. Then there is cervical factor. In some cases, it may be idiopathic. Idiopathic means that you've tried to investigate the couple, the male, the female, you can't find any cause. The tubes are patent, she's ovulating, and the sperm is okay. So I will discuss more on male factor infertility. Male factor infertility means the problem is from the man. I will take us to sperm production. The brain, just like woman, the brain controls the production of sperm in the testes. And when the sperm is formed in the testes, it's moved from the testes through the spermatic cord, then through the urethra to the vagina during the intercourse. So problem can arise either from the brain, from the testes, or along the passage to the outside. If there is problem with the brain, maybe there is the brain tumor, craniopharyngioma, or there is trauma to the brain, it can affect the sperm production. Also, if there is problem with the testes, it could be due to infection. It could be due to infection. When there is infection, it can affect sperm production. And then when the testis is exposed to heat, that is the environment, the testis is hot. For instance, people that work in any place that generates a lot of heat, it eventually affects the sperm production. Also, there are genetic anomaly. When there is genetic abnormality, like there are some syndrome, Klinefelter syndrome, that will affect the production of sperm Also, if there is trauma to the testes, it can also affect sperm production. That's what we call testicular torsion. If the testis twists, if there is twist in testes, that will affect sperm production. Most time, a man will have severe scrotal pain. If nothing is done within 2 to 3 hours, that testis will go atrophic. The testis will die naturally. Then there are some drugs that if you take those drugs, some anti-cancer drugs, when you take them, it can affect the sperm production. Also, the passage, if there is infection and testicular and the passage is affected, yes, it can also affect but that means the man will produce sperm, but the sperm will not be able to pass through the passage to the vagina. So in some cases, if for instance a man have what is called prostate now, and he goes for prostatectomy, it can affect the delivery of sperm into the outside world, through the penis, because the sperm, instead of going through the penis, it will go to the bladder. We call it retrograde ejaculation. Also, when hernia surgery is done, if it's not properly done, while doing the surgery, one can damage some nerves, and if those nerves are damaged, it will definitely affect the sperm production. Also, there are some social habits. For instance, excessive consumption of marijuana, excessive consumption of alcohol, stress can also affect the sperm production. The next is the female factor. Under the female factor, we have ovarian factors. Ovarian factors means that a woman is not ovulating. There are so many conditions that can make a woman not ovulate. One, age. As the one advances in age, it affects ovulation. For instance, if somebody is 45, 46, the chances of ovulation is significantly reduced. Then stress. When they are under stressful condition, like during war, any emotional stress, it can affect ovulation. Then weight loss. If you lose significant amount of weight, ovulation will stop. The same thing with weight gain. Then there's a disease condition in the ovary called polycystic ovary. What polycystic ovary means is that normally the egg in the ovary are arranged haphazardly. However, in polycystic ovary, the eggs will be many. They are going to arrange like a chain in the periphery of the ovary. Such women may not be ovulating. Signs and symptoms of polycystic ovary is that the woman will be obese and the menstruation will be irregular. For instance, it may be menstruating every 35, 2-3 months, maybe 4 times, 5-6 times per annum, per year. Then obesity. Then when such lady can have bed, hair growth pattern. The other thing that can affect the ovary is irradiation. If somebody have cancer somewhere in the body, for instance, somebody has cervical cancer and they have to treat the patient with irradiation, it's going to affect the ovary too. Or somebody have another cancer that needs cancer chemotherapy, it will definitely affect the ovary. Then that's what they call premature ovarian failure. In some situations, some people, their eggs get depleted. Even by 35 years of age, you realize that there's no more egg there. Such patients will also present with infertility. The next is the tubal factor. Tubal factors means that there is problem with the tubes. Before a woman can conceive, the tubes must be patent. One of the two must be patent, must be open. That means when the tube is open, the egg will be able to pass through, and the sperm tube will transfer from the uterus, and the fertilization will occur in the fallopian tube. So what are the causes of blockage of the tubes? If there is pelvic inflammatory disease, infection, and is not properly treated, it can give a long-term complication of tubal blockage. Also, if somebody have appendicitis and there's inflammation along that side, on the right part of the tubes, it can be blocked. When there is previous history of surgery, somebody has done operation before, whether ovarian cyst, it will complicate it and the tubes may be plastered together. Also, there is what they call ectopic pregnancy. If the implantation occurs outside the womb in the tubes, there's chances of recurrence, and that tube on that side that it occurred is gone. But they most likely remove the tubes, and such a patient will have tubal factor infertility. Also, that's what they call endometriosis. Endometriosis is when there is menstruation into the ovary. Normally, a woman should menstruate from the endometrium, from the endometrium. That is the innermost part of the womb. However, when there is a endometrial cells is in the ovary, each time that such a woman menstruates, she is also going to menstruate in the ovary, and it will affect the ovary. If it is severe, it will cause addition and plaster all the tubes, ovary together. Such a woman will have tubal factor infertility. Also, there what they call uterine factor. Yes, after implantation, after fertilization, the endometrium, that is uterus, must be well prepared for implantation. If there is addition means there is plastering of the innermost part of the womb together. If it is plastered together, there won't be space for the embryo to implant, and that can cause infertility. Also, when there is fibroid inside the womb, submucous fibroid, it can also affect implantation, and that will cause infertility. Also, when the fibroid is big enough to cause obstruction to the flow of sperm, such patients may have a tubal factor infertility. The sperm will not be able to pass to meet the egg in the tubes, and they will present with. The last one, but not the least, is unknown. At times, you may have to investigate the couple. The sperm will be okay, the tubes are okay. But you cannot say specifically, say it's infertility. What are the signs and symptoms of infertility? How do they present? Most times, the couple presents in the clinic with history of inability to conceive. In this part of the world, people believe that when there is infertility, yes, they should check the woman alone. No, it can be either way. It can be from the man, it can be from the woman. So ordinarily, both couples are supposed to come so that one can clear them properly. They will present with infertility that we've been married for 3 years, for more than a year, we've not been able to conceive. Then one will try and find out from the woman, how old is the woman? Because the age has significant effect on infertility. How old is the woman? How is the menses? When was the first menstrual period? Menarche. When was the first time? Was it at the age of 12, 13, 14, 15, or 16? This menses, is it regular? How many days in a cycle do you menstruate? You want to find out. Is it irregular? Irregular means that maybe every 35 days, that's when you menstruate. It's more than a month. So such a patient may likely have polycystic ovary. Some women will come and say, I menstruate only 3 to 4, 5 times in a year. So you have to look at the woman. Are you obese? Are you on the big side? Then you want to find out again from the woman whether there is production of milk in the breast, that's galacturia, or whether there is symptoms or signs of polycystic ovary. Asceutism. Asceutism means there is male pattern distribution of hair. If a woman has bed hair like a man pattern, a male pattern, you should be careful. There are some tribes in Nigeria from the east that have hair in the that have bed, little bed. That's genetic challenge. It's not because of that will not cause infertility. Then they want to find out, as you won't be pregnant before, if you've been pregnant, how many times? What was the outcome of the pregnancy? Have you terminated pregnancy before? Because most times when people terminate pregnancy, there is tendency to be complicated by infection. If it is complicated by infection, it's not properly treated, such a woman will come up with infertility in the future, because untreated thing will affect the tubes, and the tubes might be blocked. Want to find out, has there been any history of surgery in the past in the woman? Maybe she has had ectopic pregnancy and they have operated, or there have been appendicitis which have been operated. Then, more importantly, the man too, want to find out from the man, has there been any time when he was young that he has what they call mumps infections, swelling of the both mandibular region? When there is swelling in this area, then you want to find out how was it treated. Because most times it's a viral infection. When you don't have that, when you have such infection, it can affect male sperm production. Also, we want to find out whether there has been any surgery. Do you have hernia before? Have you been operated for hernia? Because that may be the cause of the problem too. Then you want to find out the life history of both of them. You drink, how stressful is your work? When you work on the mainland, you leave as early as possible, 5 o'clock or 4 o'clock, you come back 11, 12. Everything is to affect the sperm production. Instead of the body to energy to produce sperm, the energy will be directed to the brain so that you can survive first before you think about sperm production. So they want to find out, is their coitus adequate? Before you can say there is challenge with conception, you must be having adequate intercourse. What does that mean? That means every week, the minimum of time you have intercourse is 3 times per week. It must not be less than 3 times, not 1 in 2 weeks, 1 in 1 month. It has to be regular and properly timed, regular. If you have alternate day intercourse, that will be 3 times in a week. So there's no way you are going to miss the ovulation, because most times the sperm can survive in a woman for almost 48 hours. So, and the egg can only survive for 12 to 24 hours. So if you're having regular every 48 hours intercourse, definitely anytime the woman ovulates, definitely the sperm will be there waiting for the ovulation to occur, so that the fertilization can occur. So how do we investigate couple with infertility? The most easiest investigation to do. Prior to that, concentration was less than 20 million. Some people that are less than 20 million all come back. They have to reduce their figure to 50 ejaculate. A man must produce nothing less than 1.5 minutes of sperm, and the total sperm number. That means if you produce 1 male, 39 million, because each million is 15 million.